This is a role play developed as part of the course curriculum for Manage TB, an online course for doctors. The participants have enacted the roles given to them. The case discussed does not refer to any existing patient but has been developed as part of the course curriculum. The investigations such as X-rays and lab reports used in this case scenario belongs to patients treated at National Institute for Research in Tuberculosis, Chennai. Their identity have been anonymized.
Good morning, madam.
Good morning, Pratiksha.
I have a case to discuss. Can I start now?
Yes, you can go ahead.
Yes. And this is a case about a 42-year-old male who is truck driver by occupation. He has come with the complaints of persistent cough for more than 20 days. He has fever for 1 week, which is intermittent in nature. And for the past 2 months, he has loss of weight and appetite. And he is a smoker and consumes alcohol for the past 25 years. He has a history of substance abuse for past 10 years. He is known HIV positive for past 3 years and not an antiretroviral therapy. Sputum smear is positive for AFB and the gene expert results have come. It shows MTB detected and it is rifampicin sensitive. And the X-ray has also come. It shows parenchymal infiltrates.
I hope you attended the lecture on management of TB in HIV infected individuals.
Yes, ma'am.
So, what additional information have you collected in this patient?
I have asked him about any past history of anti-TB treatment, but he said he has not taken any anti-TB treatment. He is tested positive for HIV 3 years ago when he had some fever. He was advised for ART, but he did not take any medicines. His CD4 count was 200 cells per cubic millimeter at the time of diagnosis. Subsequently, he doesn't have any reports. Ma'am, he has no other concomitant illness and is not on any medications. He is a smoker for past 25 years and smokes about a packet of cigarette every day. And he also takes alcohol every day for the past 25 years. There is a history of substance abuse for the past 10 years. Ma'am, I have done an examination of the patient. He weighs around 42 kgs. He is not febrile or anemic. There is no jaundice, no clubbing and no lymphadenopathy, madam.
Okay, good. So, how will you proceed with management of TB in this patient?
Ma'am, in this patient has not taken any previous anti-TB treatment, plus he is sensitive to rifampicin. So, I would like to start him with the 6-month daily regimen of anti-tuberculosis treatment. It will consist of 2 months intensive phase and 4 months of continuation phase. In the intensive phase, we will treat with isoniazid, rifampicin, pyrazinamide and ethambutol. And in the continuation phase, it will be isoniazid, rifampicin and ethambutol. And the dosage will be according to his weight bands. Ma'am, but I have a doubt. Since he is HIV positive, is 6 months alone enough? The duration is enough or should we prolong the duration more?
Yes, you're correct about the regimen. But actually the anti-TB treatment, the regimen does not require any modification in case of HIV infected individual. So irrespective of the HIV status, the regimen is same in terms of drugs and duration. Okay. What is more important is initiation of antiretroviral therapy. Okay. So you have to do his CD4 counts and irrespective of the CD4 counts, you have to initiate him on ART.
Okay. Ma'am, should ART and ATT be started together?
No, first you must start anti-TB treatment.
Okay.
And once he tolerates anti-TB treatment, you can initiate antiretroviral therapy between 2 weeks to 2 months.
Okay.
Are you aware of the antiretroviral therapy which has to be prescribed to this patient?
Yes, ma'am. For this patient, we will prescribe the first line ART, which consists of tenofovir, lamivudine and dolutegravir. Since the patient is under rifampicin, he would avoid nevirapine-based regimens because it will cause some drug interactions, ma'am.
Yes, very good. Okay, then what more would you like to watch for after you start ART in this patient?
I think we should look for the adverse drugs reaction, which is very important in this patient.
That's very important. In addition, you must be aware of IRIS, that is immune reconstitution inflammatory syndrome,
Okay.
which can be either unmasking or it can be paradoxical.
Okay.
And it can present as either development of new symptoms or worsening of existing symptoms. And this can be treated with non-steroidal anti-inflammatory drugs and in severe cases even with steroids. But it's important to continue both anti-TB treatment as well as antiretroviral treatment.
I'll remember the possibility of development of virus now. Ma'am, I think we have to also start him on co-trimmoxazole
Yes.
prophylaxis because there is a high chance of him get with opportunistic infections.
Okay. What will you advise the patient?
Initially, I will give him a counseling because both ATT, it takes around 6 months of treatment and ART has to take for lifelong. So, I will give him good counseling regarding the nature of both the disease and what are the probable cause and how the mode of spread. Plus, I will advise him about the importance of taking regular treatment and the consequence of not taking irregular treatment. And I will advise him about the side effects which are likely to happen, adverse drug reactions. And also counsel him about to maintain cough hygiene and not to spit in public places. I will also counsel the family members to get screened for TB and tell how important it is for them. I will talk to him about that he should use safe sexual practices and advise him to bring his wife to get tested for HIV. And also I will tell him the treatment available for both HIV and TB is available free of cost in the government centers. And also I will ask him to abstain from alcohol, cigarette smoking and substance abuse.
Yes, very well done, Pratiksha. I think you have understood the essentials of managing TB in HIV infected individuals.
Yes,
so can you just outline the important points now?
Sure, ma'am.
Anti-TB treatment regimen and duration is the same irrespective of HIV status. In patients not on ART, once ATT is tolerated, ART can be initiated between 2 weeks to 2 months. The recommended first-line ART regimen to be initiated in TB patients is tenofovir, lamivudine and dolutegravir. Immune reconstitution in inflammatory syndrome, that is IRIS, can occur after initiation and requires appropriate management. Co-trimmoxazole prophylaxis has to be ensured to prevent opportunistic infections. Counseling is to be provided for management of both TB and HIV prior to treatment initiation.